on your microphone so we can hear you? The green button on your table?
The same question as before, how can we become more involved?
It's a wonderful question. I'm sure that all of us, and I will be here for the rest of the day and we can engage. We've heard other colleagues. I mean, we have individual ways that we can engage folks. In general, the general comment is that, this is a marriage, a matchmaking process where it's not only hearing about what it is, the types of things that you would like to engage in, but also aligning that with the needs of folks in the field. And we do have the folks here in this room who can help do that. I can certainly speak to you about opportunities that I have, but there are certainly people here who are very senior who also have the access to that. But I would say, the first thing is, thinking about what it is that you would like to do. Engage someone like myself or others about what are the opportunities where you might be able to be helpful. And then we start the process of finding out whether it's you want to be in the field or you want to work from the comfort of your home. There are many ways of using human capital to advance ideas without having to actually be in the field.
Yes, thank you. Over here, a question? We're moving quickly because we've eaten into your lunchtime.
I'll speak to that. Alan Saunders, Chair of the Conference of NGOs, HIV/AIDS. I'd like to work with you. I've traveled to 12 countries in Africa, 84 in the world, and our subcommittee on HIV/AIDS is now working on how we can bring generic medication throughout Africa. And we'd definitely like to know how we can work more effectively with you and provide more antiretroviral treatment to people not only in Africa but in all developing countries in the world.
Very kind of you to make that comment, and I guess the one thing I would just say to the community here is I think a lot of people, I see people shaking their heads, there are a lot of opportunities to actually advance. We've been going at it for antiretrovirals now for decades, but I think there's still a lot of untapped efforts, so use of mobile health so we can track generics to make sure that we don't have counterfeit products. And the other thing is, again, leveraging public-private partnerships involving faith-based, private non-for-profit, as well as Ministry of Health, so that we have a proper referral system. This is not about throwing money at a problem. This is about working together at the local community to try and solve bottlenecks so we could provide effective treatment.
Very good. Back to you. Is there a question on this side? All right. Does he still have a question?
Yeah, I wanted to ask a question about mental health. So do you have any idea about that issue? Because within the student community, it is a huge problem that a problem which is not raised. So do you have any thought about that?
You said mental health.
Yeah.
Well, and I did not plan this. I just want everyone to know. But actually, my dissertation, my doctorate thesis, several of my papers were actually looking at psychosocial interventions to help to improve mental health status of pregnant women with HIV. So that's a very technical topic. But the short answer is, as we all know, mental health and mental health services are actually one of the most critical aspects that we can provide in the community, whether it's HIV around stigma, whether it's around domestic abuse or abuse towards women. And it's the idea, how can we effectively provide care and treatment that may be decentralized, that may have respect for the person or individuals who are actually going through these issues. And most importantly, how do we create low-cost interventions that may improve access to HIV, antiretrovirals, or HbA1c, or insulin. And the reason, and I'm going to wrap up my comment here, the reason why it's so important is something that we've learned scientifically in the field, is that some of the most low-cost interventions around social support and mental health services have the biggest impact on improving adherence to healthcare and very costly, expensive medications. And I think it's a field that if you're interested in, other people are interested in, it's just it's ready to explode, because it's a low-cost intervention that can have huge impact for much larger, higher-cost interventions in the field.
I'm going to take 2 more questions and then we'll have to break for lunch. Who else has a question? Anyone on this side?
Thank you, Dr. Blander. We all agree that there are incredible resources being applied today against the issues that confront the world, yet we're not having the impact of those resources. Why? And what's one thing that we can do to change the impact and not throw more resources at it, as you pointed out?
It's, as like all these questions, it's a brilliant question, and I don't know if I'll have a brilliant answer, but I'll definitely respond. You know, as I opened up this discussion, we've had much resources in the trillions of dollars over the last 40, 50 years, and incredibly dedicated, passionate people engaged. So I think it's a disservice to say that we haven't done an awful lot. But certainly I think everyone agrees that we can do a lot more. And when it comes to the area of impact, it's something I'm very passionate about. We know each year we spend hundreds, actually billions of dollars on monitoring and evaluation systems of programs. But there's, in epidemiology, we have something called validity and reliability. Reliability is this idea of if you have an arrow and you're trying to hit a target, right? If you have a very compact group of arrows, you're pretty reliable. You're able to hit the same spot all the time. But just because you're hitting that spot, it doesn't mean that you're on the mark. And so as a very, out of humility and actually, again, being a court reporter for colleagues from the field who are really experts here, I put you in touch with my colleagues. It's the idea of how do we integrate feedback that might be qualitative, that again, more epidemiology, if those of you are going into public health, we can triangulate, establish indicators with some qualitative feedback from the field about how is this program working, how is it being impactful, and what might be the ways that we could actually maybe modify the way we view these programs and indicators to see if it's really, truly affecting the communities that we're trying to serve. So I don't think it's rocket science. I don't think it's magic. I think it's about bringing stakeholders together and finding ways through new information technologies to ensure that we integrate feedback from various groups, especially those in the community that we're trying to serve the most.
Do we have one more question?
Aside from obvious problems like getting enough funding, I mean, what are some of the most common obstacles that you run into when you're in the field trying to deliver this kind of care?
Another really fantastic question. I think anything in life has challenges and obstacles, and I say that as sort of a general remark because, I've done work here, U.S., Europe, Asia, around regular business activities, and each one of those were fraught with obstacles and challenges. I mean, I think you have maybe some special considerations. I think probably capital or financing, especially around innovative ideas or pilot programs, has been difficult. There are typically, fairly large donors, but relatively few large donors, and it's hard to get trickle-down sort of monies to sponsor those. I think sometimes you'll hear words like bureaucracy and other things, but I think it's also about the folks who are trying to implement. It's about perseverance. I mean, I've been very blessed, I think, with the ability to work with folks to affect change. And again, it's not a rocket science piece. It's the idea of most of the time I'm not looking like this. It's literally taking the attitude that when you're going in to try and partner, that if you need me to sweep a floor, you need me to build a PowerPoint, you build that relationship. Because if you don't build that relationship, then I ask you, how are we going to then tackle a problem like reducing infant mortality due to asphyxia because we can't clear a blocked airway? And it's really, I think, building those relationships, because the answers to those, which sound very technical for those non-medical folks here, actually those very solutions are actually fairly easy to implement. In fact, there was a conference just yesterday in Washington, D.C. that I was at, where the whole area was around removing blocked airways to treat asphyxiation, one of the biggest causes of death among infants or newborns. And the answer has been around for over 50 years or longer, but we still haven't been able to implement some of the most easiest solutions. And what was the big ticket